Central nervous system depressants. What is a central nervous system depressant? The nervous system within our body functions in two different systems, the central and peripheral. The focus today is based on the central nervous system, which consists of a cluster of nerve tissue in the brain and spinal cord, which coordinates activity inside the body, as well as coordinates how we react to the outside world. Keep in mind that the peripheral nervous system consists of the rest of the nerves outside of the brain and spinal cord. Therefore, add all terms together, which concludes that CNS depressants, more commonly referred to as downers, are substances that slow brain activity. Within depressants, you can usually find four different drug classes. Sedatives depress the central nervous system, producing a relaxing and calming effect. Hypnotics, common for procedural sedations, are used to induce sleep and can be used for a lengthened amount of time. Anxiolytics are medications used to treat anxiety, in which they decrease the human's natural excitability, relaxing the mind and body. Finally, analgesics are medications that help to control pain. CNS depressants are used to treat a variety of conditions such as anxiety, sleep disorders, seizure disorders, muscle tension, and withdrawal. More specifically, these medications can treat acute stress, panic attacks, insomnia, and epilepsy. CNS depressants can also be used as an amnestic for surgical procedures. To better define amnestic would be to state that these type of medications reduce functionality of the brain, causing a temporary loss of memory. The last use for treatment is to control pain, but pain control is primarily based on the opiate and barbiturate category, in which we'll discuss later on. On a side note, many of us have seen the scandal with Bill Cosby unravel on the news in recent times. With the allegations, it has been said that Bill Cosby probably used an amnestic on his victims. The human body is still able to breathe, but any awareness or recollection of the event is swiped by the amnestic. GHB, for instance, is a club drug that provides this type of effect. What effect do these medications have on the brain? Gamma-aminobutyric acid, also known as GABA, is known as a naturally occurring chemical in the brain that aids in communicating messages between cells. The more proper term for this reaction is known as a neurotransmitter. GABA works by slowing down and sometimes stopping neuronal activity within the brain. Although different classes of CNS depressants work in unique ways, they ultimately increase GABA activity, which produces a drowsy or calming effect. There are 5 types of CNS depressants: benzos, barbiturates, alcohol, and although classified under their own category, opiates as well as THC belong in the depressant group. Benzodiazepines, according to the DEA, are a Schedule IV class of drug that acts as a hypnotic sedative medication. Discovered in the 1930s, they were not exposed to the general population until 1957. In today's society, benzos are the most commonly prescribed depressant. Benzos slow activity in the brain, allowing for a relaxing, hypnotic, or calming effect. They are primarily used for anxiety, sleep disorders, and seizures. Many benzodiazepine medications can be used interchangeably and can have an onset as fast as 30 minutes and can last as long as 3 days. Scientists believe that excessive activity of nerves may be the cause of anxiety and other psychological disorders, and benzodiazepines reduce the activity of nerves in the brain and spinal cord by enhancing the effects of GABA. Some typical side effects of benzos include drowsiness, fatigue, confusion, and in higher doses, mood swings, aggression, or euphoria. Familiar medications could include Xanax, Librium, Klonopin, and Valium. Barbiturates, according to the DEA, are a Schedule II, III, or IV depressant that can provide a mild sedation effect due to or severe coma, making them beneficial for use of surgical procedures or severe seizure disorders. Barbiturates induce sleep for a lengthened period of time, depressing the CNS. Barbs are a derivative of barbituric acid, first produced in 1864, but the barbiturates themselves were not discovered until 1903. Physicians used to prescribe this for insomnia and anxiety, but are now being replaced by benzos. Today's use are primarily for severe epilepsy and a general anesthetic in a hospital setting. Alcohol is the most widely used depressant around the world due to its legality. Depending on the person's height, weight, regulatory use, and the strength of the drink and how much is consumed, determines the effects of alcohol. Many might think that alcohol is a stimulant because once consumed, you begin to feel happier as you become more relaxed. This may be a psychological effect. However, alcohol almost immediately travels to the brain and serves as a depressant. Although, depending on the person, alcohol may serve as a more severe depressant rather than the feeling of happiness. Common effects include blurred vision, slow reflexes, recklessness, nausea. If mixed with other depressants, one may experience a deadly combination. Although opioids and marijuana are a classified drug of their own, they are considered as a depressant. Due to them being a class of their own, I am only going to lightly touch base on the two types of medications. Most CNS depressants act on the GABA receptors, but opioids typically bind to three different receptors, the mu, kappa, and sigma. The mu receptor will be discussed in my research findings later on. Opioids are a derivative of the opium poppy plant and are primarily used to control pain. However, opiates also directly relate to endorphins and dopamine, causing a rewarding feeling. The activation of these two chemicals in the brain, as well as the pain control factor, result in a high addiction rate. Common opiates include heroin, hydrocodone, oxycodone, fentanyl, morphine, and methadone. Marijuana is currently the most used illegal drug in the United States. Within our body, we actually have cannabinoid receptors that THC will bind to. THC also triggers the release of dopamine, a chemical that is released and causes us to feel pleasure. However, THC has symptoms consistent with depressants such as reduced reaction time and increased feelings of relaxation. Therefore, when a drug is used repeatedly for an extended amount of time, the body will need a higher dose of the medication to achieve the same desired response that was initially provided. This could be classified as a tolerance. The medication can bind to either the mu or GABA receptor, creating what is called the ligand. Once this takes place, the ligand will activate the receptor and increase the functionality of the receptors. This process can be known as upregulation of receptors. The upregulation of these receptors and the increased functionality aids in developing the tolerance. One important thing to note is the body developing a tolerance to a medication does not mean that the person is addicted. Dependence begins to occur when the body becomes accustomed to the presence of the drug within the body, desiring the drug to be able to maintain normal functionality. There are two types of dependence that a person may experience, physical and psychological. Psychologically, a person's mental and emotional well-being becomes compromised. The euphoric feeling becomes something that a person soon begins to think about and crave for constantly. The physical dependence of the body deals with upregulation of receptors. Therefore, addiction can be defined as a chronic disease characterized by drug seeking and use that is compulsive or difficult to control despite harmful consequences. When a person repeatedly uses drugs, the brain begins to experience changes, making it challenging for a person to continue to have self-control and not go to extremes to keep taking the medication. Along with this, the body begins to feel the effect of the reward, or other words, euphoria. At this point in time, the body begins to release dopamine, resulting in addiction. Withdrawal begins to take place when the body no longer has the medication needed and is upregulated, meaning the body has more receptors available after a period of time. Now the body has spent an extended amount of time creating more receptors, so when the user stops, the majority of the receptors go without. When addiction occurs, the withdrawal effects are reversed. The brain activity will speed up rapidly. The person becomes extremely anxious and almost hyper. If the activity speeds up too quickly, a seizure may result as part of the withdrawal. The severity and duration of withdrawal from depressants depends on various factors such as length of time of use, dosage type, genetics, family history, and mental health-related factors. Other withdrawal symptoms could include muscle pain, irritability, lack of sleep, heart problems, tremors. And withdrawal from benzos is less severe than withdrawal from barbiturates and even alcohol, but whether it's benzos, barbs, opiates, or even THC, you should seek professional help to successfully be taken off the drug. The importance of knowing more about CNS depressants is to bring more awareness to the general population by defining what a depressant is and the effects that these type of medications have on our body. More importantly, understanding that ultimately depressants cause an impairment within the body. Many people in today's society only relate alcohol to impaired driving. However, a DUI is understood to be driving while under the influence. Misuse and abuse of CNS depressants could ultimately lead to deadly consequences. Medication management is not to be taken lightly, as the misuse and impaired driving could result in the death of you or of an innocent victim. In discussion with our emergency department director and emergency physician at my place of work, Christian Kemp, I asked him what he believed to be one of the greatest myths or misinformation regarding CNS depressants. Throughout his time, he believes that people stating that they are able to keep their use of medication under control is a myth. From observation during his time as a physician, he has seen an increasing number of individuals presenting to the emergency department for CNS depressant withdrawal, but are unaware as to the cause of the symptoms that has caused them to seek emergency care. Addiction is a deadly disease, and the acceptance that you have lost all control of regular use is an increasing epidemic in today's society. The most significant part of our class population is truly understanding the withdrawal process and what a person goes through if they ever want to continue back to a normal life. In previous slides, I touched base on withdrawal and what effects it can have on the body. However, I'm going to aim target at the legal depressant alcohol. Due to the legality, it speaks more to the general class population. More specifically, delirium tremens, the severe form of alcohol withdrawal, is a true medical emergency, with the most common signs being heavy sweating, irregular heartbeat, lack of eye movement, and muscle tremors. It is especially common in those who drink 4 to 5 pints of wine, 7 to 8 pints of beer, or 1 pint of hard alcohol every day for several months. Delirium tremens commonly affect people who have used alcohol more than 10 years, but they can begin to occur 48 to 96 hours after the last drink, and if left untreated can result in death. How does death occur? Again, delirium tremens ties back to the upregulation of receptors. In the summer of 2013, a group of physicians conducted a scholarly article regarding benzodiazepine pharmacology and the effects on the central nervous system. Without understanding the pharmacology of the drug and the effect it can have, using it as a prescription could result in unwarranted effects on the body. Due to benzodiazepines being the most widely used pharmaceutical, they choose to focus more on their research in elderly patients. It was concluded that elderly patients struggle even more with the adverse side effects than the rest of the population. From 1980 to 1987, research was conducted regarding the direct relations between benzodiazepines and motor vehicle accidents. It was concluded that impaired driving leads to accidents, mortality, and individuals who need emergency care, whether on the scene or in a hospital setting. In 2 studies, benzos were found in 43% and 65% of the people being tested, and then in another study with controlled factors, only 5% and 2% of the drivers involved in accidents had used benzos. The ultimate conclusion, however, is that benzos can double your chances of impaired driving, and those individuals that are 65 and older show an even higher risk if they have been on benzos for a lengthened period of time. Understanding the effects of benzos and our memory have consistently been researched and reviewed. Specifically from 1973 to 1985, research studies were completed regarding the amnesic effects after a benzo has been taken. Amnesia and tranquilizer could be used as terms that walk hand in hand. Depending on the dose of the medication, duration, and how the medication is taken are variable factors to the degree of how they affect their memory. With this, it was discovered that benzos affect more of our long-term memory rather than short-term memory. During the time of use of the benzo, increased impairment with difficult tasks occurs, and short-term memory loss during the duration of medication could result. Although, as discussed earlier, opioids are a class of their own but do act as a central nervous system depressant. Therefore, instead of acting on the GABA, they act on the mu receptor. The mu receptor plays a role in dealing with pain and also causes a reaction within the central nervous system. Again, in discussion with Dr. Christian Camp, he began to talk about the holy grail of all research, and if I never wanted to worry about money again in my lifetime, I needed to find the solution to this specific research. When asked how I could get rich, he began to talk about the mu receptor. The mu receptor, which deals with pain signals, obviously affects the CNS system because the receptor is a neurotransmitter in the brain. Multiple research studies are being conducted right now, as this will perhaps be one of the biggest breakthroughs with pharmaceuticals. Research studies need to produce a way that a medication that directly deals with the pain the body feels without affecting the mu receptor in the brain. Doing so would allow for addiction rates to significantly drop, especially to opioids. The medication would treat the brain without causing any euphoric effects on the brain, not allowing for addictive behaviors to start. In conclusion, the central nervous system depressants are a commonly prescribed medication that is often misused. These medications act on different receptors in the brain, ultimately affecting the CNS. Depressants are also known as downers due to the sedative side effects that it can produce by slowing the brain activity. Being aware of how these medications act on our brain and the effects that result bring more awareness to society. The importance of following a physician's advice and taking recommended doses is the best way to avoid the serious consequences of a drop, which include addiction, withdrawal, coma, or even death.